Even 90% of the students don't know that they have DM cardiology. So many of the people also take pulmonary medicine as a route to cardiology.
So if I do a DNB in a corporate, will I have enough skill set by the end of 3 years, whatever is expected of a postgraduate?
Those who have finished earlier, they have taken the faculty post and have settled there.
Sir, confused between pulmo, emergency, and anesthesia.
One thing I would say is not go with your rank or not go with your the fantasy of branches out there.
I think medicine people do all OPDs. They do derma, psyche,
Yeah.
everything.
That is
They
even
can't do surgery, otherwise they will do surgery also.
yeah,
So there's a rumor that MD respiratory medicine is going to be removed and it's going to be replaced by DM pulmonology.
So the thing is like that. I will not say you have very good opportunities. You have to get the opportunities. That is only I can say.
Okay, sir. So we can start the session. So first of all, thank you so much for joining, and
I have to
I welcome you.
arranging it at the right time because I'm getting so many messages every day regarding respiratory medicine scope and all. So I was planning to do a video, but I thought this will be a good platform to address everyone actually.
Yeah, true. Because this is the time now. Today, registration also started
Yeah.
for NEET.
Yeah.
So, welcome guys in today's webinar on respiratory medicine as a branch. Hope this webinar will gonna help you in your making the decision. So, let's start first of all. Like, why did you choose the respiratory medicine?
Why did I choose is because I am always interested in medical branch first of all. So the thing is my options, I will not say that pulmonary medicine was my first priority. I was interested in general medicine and pulmonary medicine both. But since I did not get a medicine seat, and also it was during COVID where I felt that respiratory diseases do play a role in how severity everyone has seen during COVID. So I thought it needs to be studied, and it is also a wide subject and an branch. So I can do some good fellowships and all. So I've taken respiratory medicine. So that was I was interested in medical branch and also an N branch in the first case.
Oh, and from which college you did?
I did from Maharaja Institute of Medical Sciences in Vijayanagaram, which is in Andhra Pradesh.
In Andhra. Okay, okay. And how was how's the training exposure in during the PG?
Yeah, we were only two PGs that time, only two seats we had. And we had good hands-on, you have many interventions like pleural effusion tappings, intercourse ICD insertions. We have bronchoscopy, thoracoscopy. We had good exposure and good hands-on. And it was also a rural area, so we could get lots of respiratory cases like pneumonia, effusions, and also TB cases were also very good there. So we could cover all the respiratory cases like ILDs, asthma, COPD, and we had good exposure of all the cases actually.
Okay. And so, which are the best colleges for the pulmonary medicine in India?
Government,
Yes.
at present, I can give an idea on south because north I don't have much idea.
Mm-hmm.
When it comes to my state, the government side first will be the Andhra Medical College from Visakhapatnam. Next will be Guntur Medical College from Andhra. And this one we have Usmania from Hyderabad, Gandhi Medical College from Hyderabad, NIMS, that is Nizam Institute from Hyderabad. And also we have Rangaraya Medical College from Kakinada, which is also in Andhra Pradesh. These are quite, they have so much intake of students. Like Andhra Medical College has like almost 14 students per batch. And the Guntur Medical College has 6 students per batch. And Usmania also, you have around more than 5 seats like that. So you have good intake of PGs in all the South colleges. Even when it comes to Madras Medical College and all also, everything is, and in Delhi you have National Institute of Tuberculosis and all. So there are quite good colleges in government and also DNB. DNB also you should, there is no doubt in DNB you don't get exposure and all. I've done periphery postings in DNB college and DNB hospitals in Bangalore, like Manipal, Mahavir Jain College and all. So they have all the new technologies, equipments and all. So I will not say don't take DNB. DNB has also very good college.
So, DNB, how much is rank difference between DNB and MD Pulmo?
There is nothing difference. The same exposure you get, only the exam.
I'm asking about that. How much rank difference is there in getting the college for MD and DNB approximately, not exact, but approx.
Approx, I can say that 3,000, 2 to 3,000 ranks. That's it.
2 to 3,000. Okay. And what are the DM option after the MD and the fellowships?
Yeah, you have DM like DM cardiology, DM pulmonary medicine, DM infectious diseases, and also DM critical care. You have all these four you have, and DM genetics also they have introduced in last 1 to 2 years actually.
Cardio also. DM cardio also.
Yeah, that is what everyone is not having that idea. I'm very shocked to know that many don't know. Even 90% of the students don't know that they have DM cardiology. So many of the people also take pulmonary medicine as a route to cardiology.
Okay. So,
And you also have fellowships like fellowship in interventional pulmonology, fellowship in sleep medicine, fellowship in critical care medicine, and fellowship in allergy and all. So you have lot scope of fellowships also.
okay. And like just after graduating, completing the MD degree in Pulmo, like how much salary someone can expect?
So if you start as an SR, that is senior resident, year pay will start from 80,000 and it can go up to 1.4 because central institutes pay you 1.4 lakhs. And some states also give you 1 lakh, 1 to 1.12. Some states are paying, the least is 80,000. The highest will be up to 1.4.
And what about the job situation in Pulmo?
Truly based on my 2 years experience, I am saying it. The opportunities are less at present since the competition is much, the hospitals are more, and many graduates are coming out, especially in pulmonary medicine after COVID. Before COVID, it was like very less number of pulmonary physicians. So those who are thinking of taking pulmonary medicine should definitely, during the PG only, have to see the general cases also. Have an idea of general cases, like at least diabetes, hypertension, all the general fever cases, and they should also be very well trained in ICUs and also emergency cases. Because now wherever I go, people are more interested to take me as an ICU physician. So that awareness is still lacking because even the hospitals run by the doctors, they are interested to show the cases to general medicine and have the pulmonary medicine as on-call consultant. Because most of the cases the general medicine sees are respiratory cases. So the thing is, it has become like it is seasonal. You only get during rainy and winter seasons like this obstructive airway diseases or anything. So everyone have that mindset like you don't get cases every day. But the thing is, the viral infections are there, the consolidations are there, effusions are there, TB cases are there. But the awareness which was there during the COVID, that there is a pulmonologist, we have to go to a pulmonologist, has come down again after COVID. So people are first going to general medicine. So that awareness still has to be created, which I'm trying more in my ways possible. But those who are thinking that we have very good scope of job opportunities should think, because this is purely based on my experience. Even my seniors who got a job in the corporate sectors or good private sectors, they have settled there. They are not coming out because that situation is like that. And you definitely need to have a fellowship like interventional pulmonology or critical care if you are going to settle with only pulmonary medicine. And you also need to have this exposure of general cases. Usually we have this thing in colleges that if a patient says I'm diabetic or hypertensive, we say go to general medicine OPD for the medicines and all. So you have to start seeing in your pulmonary residency only, deal every case. like an MBBS doctor where you see all the cases, people are wanting you to see the general cases, and people are also wanting to replace you as a general physician in some setups. So the thing is like that. I will not say you have very good opportunities. You have to get the opportunities. That is only I can say.
I mean, major scope is only in private setup. Then government setup is very less scope, right?
Yeah. The faculty posts are very less. Even those who have finished earlier, they have taken the faculty post and have settled there. So you are not getting much, and you don't have government jobs particularly dedicated to pulmonologists. There is also general medicine, and you also have to be as a general physician there.
True. And I think government jobs, if you see just about government job, I think in other specialty also there is very few government jobs are available.
Yeah.
Only few.
The compared to the PG seats they are allocating, the faculty posts or government posts they are giving, there is very wide difference actually. According to the PG number, if you have the same sort of faculty posts or anything, it would be very good. But my suggestion is, if you do if you do the pulmonary medicine, make sure you have an institutional backup. Like you do a research and do as faculty in either government or private, and then set your own clinics and start consultations after that. Because this institutional backup, you'll have this fixed income. So you can also happily see your clinic and all. Institutional backup is very much essential now, irrespective of any branch.
True. In that backup and private practice, you have to like the person degree is not important nowadays.
Yeah.
Is important. How he wants to.
How well manage every case is important now.
Yeah, that's more important because recently I took my grandfather for cough. He was having prolonged cough, and obviously, first of all, majority will go to MD medicine only.
Yeah.
Only they will go. So we took him later on to pulmonology, but he was not MD pulmonologist.
Okay.
He just diploma, but he was very well experienced from last 10-15 years. So degree, actual degree does not matter in real practice. True. And now the pollution also rising, so I think cases also rising.
Yeah. That is what I'm saying. People are more interested to get a cough syrup and cough tablets or cold tablets from pharmacy, and after 10-15 days they are liking to visit a doctor. That too, they go first to the general medicine and come to this. If general medicine refers, they are coming to the pulmonary physician actually. So that mindset has to come still in many people actually.
True. It will gonna take time. Just like other specialty are also struggling, like psyche. I think medicine people do all OPDs. They do derma, psyche.
Yeah. That is,
they can't do surgery, otherwise they will do surgery also.
Yeah, because now MBBS can be a civil assistant surgeon and do all the cases. So medicine people are also ready to do all the cases to have that money in their pockets actually.
True. So I think, my questions are completed. Like, guys, you can unmute yourself and you can ask your queries freely. You can also want any comparison with branches also, you can ask to sir. So sir is experience. It will be better if you unmute and ask, that will be better option. But I will also read out some few questions. Sir, confused between pulmo, emergency and anesthesia, 13K range, general category.
So if you are getting emergency medicine, so one thing I will say is not go with your rank or not go with your what you will say the fantasy of branches out there. The first thing, your brand will always make your career. So you have to live with that branch all your life. So it purely depends on your interest. Whether you are wanting to see a specific sort of cases, or you are interested in critical care, or you are very much interested in emergencies and all. So pulmonary medicine, emergency medicine, anesthesia are 3 different branches. So if you are very much interested in critical care and all, do emergency medicine or anesthesia and go for critical care. if you want a medical branch with interventions, because I can say pulmonary medicine is the only branch with interventions like bronchoscopy, thoracoscopy, EBUS, and the many ultrasound guided procedures and biopsies. So if you want an end branch with fellowships and good work-life balance, you can go with pulmonary medicine. So can't compare three branches. When it comes to such situation, your interest matters there.
True. And is there the next question is, I think VP Chase Institute Delhi. I don't think you have idea about North India, right? Yeah, okay. Is there any scope after doing fellowship in intervention pulmo?
Depends on the city you are going to set your setup, and also means if you are going to continue in corporates like some assistant consultant or something, you can go for that, because FIP, if when you do FIP, you have to have that setup. It's not possible to have all the thoracoscopy, EBUS and all in your own setup. So you have to join as a consultant where you have such interventions. And when it comes to your own setup, bronchoscopy is highly enough, because telling to people that get a bronchoscopy is very much tough now, because explaining about the procedure and people giving their consent is very much difficult now. So if you do a fellowship in interventional pulmonology, make sure you work in the metropolitan cities and also the corporates. That's it. If you don't practice all the interventions after completing that fellowship, it doesn't make sense.
True. And what are the good places to do fellowship from?
You have colleges like Amrita in Kochi, and also Coimbatore, you have KMCH. And when it comes to Telangana, you have Yashoda, KIMS. These two take very good intake of students actually. Yashoda produces very good amount of fellowship candidates every year.
Yashoda, I guess in Delhi also there. Ghaziabad. There are three. They're different Yashoda?
Yashoda is in Delhi also, but most of the people do fellowship from Hyderabad Yashoda.
Okay.
So they have like 4 to 5 branches, and all the branches have this fellowship in interventional pulmonology intake every year.
Okay. Someone is confused between MD respiratory and DNB general medicine.
No, don't get confused in such things.
Take DNB general medicine.
You have to take it. Take it. That also I'm telling you, no. If you are interested in seeing all the cases and all the systems, then go for general medicine. If you don't want that much stress, and if you want certain number of cases and you have to concise yourself for one kind of system and want to do fellowships, then you go for respiratory medicine. If you are planning for super specialties in other systems like gastro, nephro, neuro, then I'm telling no, your future planning depends on your branch. So you have to have that mindset. What are you going to do after doing your PG? Based on that only you have to go. Not like someone has said there is a scope in this branch. Someone has said this branch is saturated. Not that. Your interest makes the career. That's it.
And Mega asked that, sir, it is more important to select a place with more hands-on procedure or a place with more variety of cases.
See, both are important, because if you don't do a bronchoscopy or any ultrasound guided biopsies in your residency, then there is no use of taking such college. You have to have the basic knowledge of basic procedures like bronchoscopy, ultrasound guided procedures, ICD insertions and pleural tapping and all. And also you have to see variety of cases like you also have to manage the ICU emergencies of asthma, exacerbations or respiratory failure cases and all. So it has to be combination of both. I don't say you have to see very rare cases, but you at least have to have the exposure of basic cases like consolidations, obstructive airway diseases, at least some cases of sleep apneas and all. But basic knowledge of interventions of bronchoscopy and ultrasonic guided biopsies or procedures, pleural tapping and ICD insertion is a very must. You're on mute.
Sir, my rank is 11,600 OBC. I like respiratory medicine. Can I get DNB while selecting college? What should I inquire first?
See, as I already said, there is no difference of DNB or MD.
Yeah.
Basically, you get it is good only because DNB also you have to see the institutions. Try for good institutions in good cities rather than peripheral institutions. If you get DNBC with good, because most of the DNB institutes have this all the interventions like bronchoscopy, EBUS and all. So you have to go for DNB. There is no backing of not taking DNB respiratory medicine.
And sir, diploma.
Diploma, that is what I was saying. If you are very much interested in respiratory medicine and you are not getting the DNB 3 years course, and you also have the patience of doing secondary DNB, then go for diploma. Even after, because the major backlog with this diploma is you can't do fellowships also. You definitely
You can't do.
for doing fellowships also.
Okay.
So you have to
But-
clear your
But
PD.
people are doing with even just MBBS also, no?
The DNB 3 years course you can go.
Hmm.
With that, you can do fellowships, you can go for SRships and all. But DBCD, you don't have that opportunities now. You
Okay.
definitely have to go for secondary DNB.
Okay. How is DM Pulmo different from MD Pulmo? It is too different. Is
Yeah.
it up-
DM
up-
is a specialty. So you
Okay.
get good exposure on sleep medicine, critical care, and also the interventions more than the MD. Because most of the DM institutions have all the EBUS, cryobiopsy techniques and all. So these play a critical role now for all the lung masses, and also many corporates are getting this foreign bodies in lung or airways, and many mass before surgery only we are able to debulk the mass and also reduce the size of mass through this interventional pulmonology. So you get that exposure in DM. Basically, the critical care and sleep medicine also plays role in your DM.
Do people crack DM cardio with MD TP with MD Pulmo? You've seen
Yeah.
people?
Yeah, my friends and colleagues have landed in DM cardiology after MD pulmonary medicine. Most of them have taken DMB cardiology because since the question paper pattern is that you have to study all the systems for medical group. So you'll have to give your exam in medical group for super specialty. So there you have to have the knowledge of complete Harrison. So you have to read all the systems. So pulmonary medicine people usually get very low ranks compared to medicine.
Obviously, they will gonna have that edge, that advantage.
Yeah.
Obviously.
So mostly this pulmonary medicine people are landing in DNB cardiology, Doctor NB cardiology, and some DM private colleges.
And
Who took many people who I know only took cardiology after pulmonary medicine.
okay. And how is the colleges in Andhra toxic?
No, not at all, not at all. I've done my practicals in government college. I have many friends in government colleges. The pass percentage in government college is 100% every year.
DM after PG like sleep or fellowship in intervention, which has a greater scope?
After MD,
Yeah.
scope of intervention or sleep.
Yeah, sleep or fellowship in intervention.
See, as I said, no, sleep is very important. It is better to have a sleep fellowship, but it's not like if you do fellowship with sleep,
What is there in sleep fellowship?
that means OSC and all. You have obstructive sleep apnea and all, no, and you have sleep studies, the treatment of sleep apneas after that and all. So there is a fellowship for everything of that. I don't say you'll get more chances after doing this fellowship, but it is better now. Everyone is having this snoring problem and sleep apnea problem. So it is better to do, but I don't say you'll get more opportunities after doing that. And intervention, as I said, based on the city you are planning to practice, and also based on the setup and cities or the institution you are going to practice. Both are different. You can't compare both.
True. So, a lot of corporates don't have enough hands-on and many government don't have good equipment. So how to find a middle ground?
See, government usually have the basic setups of bronchoscopy and everything, even ultrasound guided processes and all. Only the e-bus many government colleges are getting now. So that is why many do fellowship after completing their PG. I don't think if you don't have e-bus, your degree doesn't value. But always it is the clinical respiratory medicine which plays an important role. So not every case needs intervention. Having interventional knowledge is compulsory, but it doesn't mean that if your institution doesn't have this e-bus and many newer equipments, it doesn't mean that that institution is not good for doing your post graduation.
Okay. And someone asking about better scope in medicine, emergency medicine, pulmo. Already, I think you said about this. But getting about interest area, right? Okay. And there are some good DNB institute for respiratory medicine.
Yeah, I say NIMS is there, and you have Apollo in Hyderabad, and Chennai also you have. You have Mumbai also. You have many like Hirandani, PD Hinduja, and many good institutions are there.
Okay. Yeah. So I
Even
think
National Institute of Tuberculosis in Delhi.
okay. Majority question we have covered. If someone has any question, you can unmute yourself and you can ask. And how is your? Are you satisfied with your decision?
At present, I can say 70% satisfied because I'm getting good referrals, good cases. I'm doing procedures and all. But the thing is, we are not having much opportunities in corporates now. Because if you do a DM in pulmonary medicine, people are more liking to take DM candidates in corporates. And if you are an MD candidate, if you have like minimum of 3 years experience after completing your post graduation, they're willing to take you. Those who have established themselves in corporates, no, they're not coming out. So the recruitments are not happening.
In DM, then the area become more narrow. When you complete your DM, Pulmo, then the area will become more narrow, right?
No. Pulmonary DM seats are very less actually.
Okay, so it's similar like Pulmo MD only, but with more experienced.
More experience and very less seats. Now the scenario is super specialty have always an edge over postgraduate. So those who have done their DMs are immediately getting good opportunities in corporate sectors.
If they are getting at same price or same amount.
If you are paying like 1.5 for a postgraduate, like MD holder, yeah, they are giving like more than 3 for a DM candidate.
Nice.
Because they see more critical cares and fellow interventions also they do more than an MD candidate.
Okay. Or sir, any idea about SDS Bangalore?
SDS.
What is SDS, guys? Please write full form. Is PDCAT for respiratory medicine difficult to crack? What is PDCAT?
PD set. After
PD.
I don't think so because many of I known people have cleared the PD set and landed in secondary DNB. So it is not that difficult to clear as of I know.
It is a diploma course, right? After diploma.
After diploma for secondary DNB, it is an entrance test.
Okay, got it. Yashoda Hyderabad and Pranium Lung Institute Vadodara. I don't know, sir. Don't have idea about Vadodara. Sir has idea about Yashoda.
Get Yashoda, you can go for it.
Yashoda, you can go, na? Okay. You can't compare pediatric versus TBRD, bro. How can you compare these two branches? If you are getting pediatric, take pedia.
And that is what.
There is no comparison.
Many people are doing this thing only. They are after the graduation, what income they'll get or how the situation is outside. Based on that, they are taking the branch. It is doesn't work like that. It is your interest and what
interest and like not in saying in other words, but if you are getting at the trend, then take it. General medicine, take it. DNB medicine. If you are not getting, if you have some lower rank, then you can take respiratory medicine. Or if you are going down, you can take anesthesia. But you can compare anesthesia and respiratory medicine, but you can't compare medicine, general medicine, and respiratory medicine.
That is very foolish thing to do.
Yeah, true. Respiratory versus anesthesia, like they are getting similar job opportunity after all.
Yes, but
anesthesia people have more advantage, I guess.
Yeah, they have this OT work in OTs. That is the advantage they have.
True. So say secondary DNB people can't do DM, right?
They can do.
They can do. So you did diploma, you did secondary DNB, then you can do DM.
Yeah, you can do.
Okay, but I think that path has become more longer than, and since you settle, you have to study again. It's very tough.
No, this diploma is 2 years and secondary DNB is 2 years. So 4 years you have to do pulmonary medicine. Then after that DM and all, it will be a long journey actually.
True. And now you will also settle with your family also. There will be many other personal things you'll be also gonna do in next 2-3 years.
Clear the entrance exam for secondary DNB and all. So this 3 years of journey is only very tiring, and after that working is also very tiring and all. So you have to make decision based on that.
True. That is Rajiv Gandhi Institute of Chest Disease, Bangalore.
Yeah, it is good. It is good. Yeah, you have good exposure.
Yeah. Okay, so I think we have completed all the questions. Any question remaining, or you can unmute or you can ask? Yeah, I think we have completed all the questions. DNB, the last question is DNB. Has someone asking question? You can unmute if you want. Please repeat the DM options.
So you have DM cardiology, DM pulmonary medicine, DM critical care, and DM infectious diseases. These are the 4 main.
Okay. And
Hello.
MRCP also people can do? Yeah. Ask.
Hello.
Yeah, sir. So if I do a DNB in a corporate, will I have enough skill set by the end of 3 years, whatever is expected of a postgraduate?
Yeah, obviously, because as I said, I have done my periphery postings in DNB Institute in Bangalore.
Okay.
So they have very good cases of all the critical and very good interventions also they are doing there. So they have all, you have the pulmonary function tests like spirometry, DLCO and all.
Okay.
So they do according to the proper guidelines there. They have very good setups for doing such tests and all. So you'll have good skill coming out of it. There is no doubt.
And sir, in some corporates, I've heard they don't really allow you to do your peripheral posting and all that. So is that true?
DNB, you don't have any peripheral postings at all. Only MD colleges you have peripheral posting.
Okay.
So DNB you have to do in the same institute.
Okay. Thank you.
That question is asked. Yeah, I think the risk of TB.
Yeah, every department has risk of TB, man, because it's such.
Just department, every Indian has risk of TB.
Yeah. The patient who goes to other department, he will not say he has cough or he is taking TB medicines until unless you ask or until unless you test him. So it is not like that. See, I'm been doing it from last more than 5 years. I never contracted any TB disease and all. So yes, MBBS and medical system is only risk of infections. So what is TB and all?
True.
So you have good hygiene, you have good diet, you have good surroundings in your family and all. So you're not someone who is coming from very low socioeconomic or very slum areas to have that fear of getting TB.
True.
So there is no need of thinking about contracting TB infection.
True. Harshit, you want to ask anything? Nuclear medicine, so I don't think nuclear medicine is very different to the rest of medicine.
But as I said, make sure you see all the cases have knowledge of every case, because that will be useful in your own setup also.
Okay.
So that is what I'll say. Don't think that after respiratory cases, you are going to settle very soon and all.
True.
Have that exposure of ICU cases, general cases in your residency. And also during your SRship or any, if you join in some central institute, you'll obviously get that exposure. So don't think only on respiratory cases you are going to
Good.
or anything. That will not.
Just last question I will ask, then we'll conclude the session. Like if they are seeing this session and they want to ask to their colleague or their seniors who are doing respiratory medicine, if they want to do research about the college, what should they ask to them?
They should ask them the hands-on on the procedures, the minimum equipment the college is having. You should have at least an ultrasound in your department, and ICDs and bronchoscopy is basic. And the general cases of asthma, COPD, and the ventilators, such minimum essentials, if that college is having, you can go and join easily.
Okay. So bare minimum should be there.
Yeah, bare minimum.
Bare minimum. True. So thank you so much, sir, for your time and for all the
Good evening, sir. Can I ask one question, sir?
Yeah.
Sir, there's a rumor that MD respiratory medicine is going to be removed and it's going to be replaced by DM pulmonology. Is that true, sir? And how is the job market, or how is the residents' life going to be affected if this happens?
No, as of now, there is no such thing like any guidelines have come. They have removed it from undergraduate. That is true. But as of now, there is not very soon. There is a rumor of that. But as I know from many seniors from my fraternity, no one has said that it is happening very soon. There is an idea of replacing it only with DM pulmonary medicine, because you have very less seats of DM pulmonary medicine, and they are wanting it to see as a super specialty branch only, because many MD medicine people also do DM pulmonary medicine and critical care, because it involves critical care also in it. So not very soon. You still have time, and whenever that time comes, they'll definitely tell you, because after taking the students into MD pulmonary medicine, they all of a sudden can't remove the branch. So those who have graduated, there is no risk of their jobs or anything. MD is MD only. There is still time, not very soon. It will take time. As I said, the scope of job opportunities at present, many are wanting you to work in ICU and be as a consultant, like case basis consultant or something. The awareness is not still there among people, but as I said, you better have an institutional backup and also have your own practice. And if you are someone wanting to do in private sector, make sure you handle wide variety of cases along with the pulmonary cases. Then only you'll have good job opportunities.
Okay, sir. Thank you, sir. And sir, for DM pulmonary medicine, the exam, the NEET SS which you give, for that, the question paper is based only on MD respiratory medicine syllabus, or it's full medicine syllabus?
Yeah. Pulmonary medicine is a separate paper. So respiratory medicine, you have separate paper. Everything is from respiratory medicine only.
Only if you want cardiology or infectious disease or CCM, then you have to go for medicine.
Now, from this year, CCM is also separate paper.
Yes, okay, sir. Just if you want cardio.
In cardiology and infectious diseases, you have to give the medical group exam.
Okay, sir. Thank you, sir.
Yeah.
Okay, sir. Thank you so much for your time, for your patience, for answering all the questions. So if you guys have remaining question, you can, I will share sir's Insta link. You can follow sir, and you can ask your queries in DM. Sir will happy to reply you all. Thank you so much. Take care. Thank you guys. And all the best guys for your counseling.
All the best to everyone attending NEET PG counseling.
Thank you so much, sir. Bye.
Bye.